Hello everyone! Thanks for joining our latest episode of Ask Me Doctor, a health video series for you and your family. A special series brought to you by Motherhood.com.my. I'm 𝗂𝗎𝙑 a mother of two, and if you're trying to conceive, know that you're not alone. The journey to conceive is not always easy and sometimes it's a tough mountain to climb. So how do we take care of our mental health when planning for pregnancy? So today we have Dr. Natasha, a fertility specialist who has gone through her own challenges in her journey to conceive. So welcome to the show, Dr. Natasha. It's so great to have you here today, and we look forward to your insights on how we can keep our mental health and emotional well-being in check through the ups and downs of trying to conceive.
Hi Lisa, thank you for having me on this show. This topic is a topic close to my heart, and we shall go into the details of how we're going to go through and making sure that our mental health is always good while undergoing this fertility journey.
Yes, it's actually a very important topic to actually talk about, right? Mental health.
It's my honor to share with the viewers how we're going to go through fertility journey with all the ups and downs of the emotional challenges.
Yes. Okay, so I'm actually excited to ask you on our first question. So can you tell us how planning a pregnancy can affect our mental health?
Planning a pregnancy can be stressful, and not everybody gets pregnant with the first try. So some couples will take about 3 to 6 months usually, but some will take even longer, even years. So even with age-negative tests, the stress gets higher, and the more stressed you are, the harder it is to get pregnant. So you fall into this vicious cycle of, not able to get pregnant and getting stressed about it. It really can be quite difficult for couples trying to conceive when they get into this emotional roller coaster. And this can also lead to anxiety, guilt, and depression if left untreated.
Okay, so I do have another question. So what can we do to look after our mental health when trying to conceive?
Some of the things is actually to take care of yourself. A lot of people do forget to take care of yourself. By having a healthy body, you would actually be able to produce better eggs and also be able to, have a better approach in facing all these, difficulties, these struggles, right? You'll be able to cope better. But if you have a poor physical health, it will affect your mental health. So when we feel good about ourselves, we are able to cope better.
When you're not taking care of yourself, you will realize that, everything is neglected. So it's always good to, give yourself some self-love so that you can cope with certain disappointments that may come along the way, right?
Yeah. And so another important thing that a lot of people, like you mentioned before, you are not in this alone, right? Have your support system. It's very important. You should be honest with your feelings. You should talk to someone that you can trust, especially in the disappointments when you do get a negative test, right? So the journey to having a baby does not have to be a lonely one. You've got lots of your TTC friends who will help you and support you along the way.
Yeah, definitely. I would have to agree with you, especially support actually plays a huge role because, not being able to conceive doesn't mean you're a failure. It's just your body is telling you that you're not ready, and maybe you may need some advice from the doctor to, give you a little boost when it comes to trying to conceive. So having a friend, or maybe talk to your family, your sister, whoever that you trust, is good to let things out so that you don't feel like you're alone and,
shouldering all the burden.
Yes, letting go of those feelings actually help, correct?
Yep, very important to release all the stress.
Jumping to our next question, why is it important to look after our mental well-being?
Okay, so being in a high levels of stress can lead to actually, firstly, lowering your chances of getting pregnant. Even if we do treatments like IVF, stress can also affect the chances of success. So I'll make sure that the patients, if they are undergoing the IVF treatment, I'll say make sure that month your work load is reduced, right? Make it flexible, or probably as much as possible negotiate that you have time off or much reduce less work. So because you'll be less stressful, you need to prioritize that and make sure that you allocate time to self-care, right?
Self-love, right? You have to pamper yourself. And
absolutely. Sometime me time. Right? You need to schedule in me time. So while it's very still possible to conceive while in having high levels of stress, having chronic stress while being pregnant can cause several issues. For example, having preterm labor, and it can also affect the baby's development in the womb. right?
Wow.
It can also affect long-term a baby's temperament and the behavioral development, as studies have shown that mothers who have experienced high levels of stress, especially in the first trimester, have babies who shows signs of more maybe depression and irritability.
Oh gosh.
No worries, I know it's very difficult if you tell a mother, you know, but I will probably get more support, ask them to relax, have me time, have more rest as much as possible.
Right.
And that will help reduce the stress for sure.
I guess when you're happy, your body's happy, right?
Yeah, you probably conceive a bit, you know, more naturally and faster.
Jumping into our fourth question, are there any warning signs that couples who are trying to conceive might have when it comes to mental health? I understand that this journey can be very mentally exhausting and it puts a strain on couples' financials as well. So can you advise on that?
Yeah. Some of the signs of mental health issue during their fertility journey is that we should look out for symptoms such as persistent feeling of, you know, sadness most of the day, or maybe more than 2 weeks or longer. Or perhaps sometimes loss of interest or pleasure that in activities that the person enjoys. You know, maybe, you know, they enjoy doing a certain activity like a movie and they no longer have interest. So these are possible some symptoms that you may need to look out for. Other symptoms can include fatigue, lack of energy, feeling restlessness or slowing down. They might feel a bit of guilt as well, worthlessness because you're unable to conceive. So a lot of women share this experience, share these emotions that whenever they are unable to conceive, they have a feelings of guilt, unable to, you know, perhaps give a child to their partner. So they feel difficulty in concentrating, trouble sleeping, and perhaps worse is we need to be aware they're having recurrent thoughts of death or suicide. So this is very serious. If you are part of the fertility journey or you have some loved ones, be aware of some of these possible symptoms and flag signs basically, and get some help if you do have or experience or your loved one are having these behavioral symptoms.
Yeah, I think this is where you know, when you don't let go all those feelings out, you're just feeling like you're carrying a very heavy load on your own, right? So again, letting all the audience know you are not alone in this scenario. So don't worry about maybe not conceiving, or if you're stressful about being a new parent. There's always a way to actually control your mental health, as advised by Dr. Natasha here. Right? Okay, so for the fifth question for today, we have, where can we go for help if we're struggling with mental health issues while trying to conceive? Because I guess trying to conceive is its own journey, and sometimes it's very stressful when you're trying and you don't achieve what you want. So can you advise?
Yeah, in my clinic basically, I'm aware of all these mental stresses. So a lot, actually part of my job also is to basically help patients go through these emotions. I will be able to, you know, advise them what do they need to do, simple steps. If I find them struggling with mental health, I may be able to recommend them to perhaps a psychologist, right? Because people get terrified if they say psychiatrist. So I probably refer to a therapist, a psychologist, to see whether there's any simple steps or behavioral changes that we can help them with. Now, for those who have a bit more serious, like a depression and suicidal intents, then probably involving a psychiatrist would help. You know, if you will see in Asian culture, we are not those who talk to psychiatrists or psychologists.
Definitely. It's not a norm yet.
It's not a norm
Asia.
yet, but yeah, I think we are more aware of these mental health issues and more acceptable in our community to go and seek help, whether it be a psychologist, whether it be a psychiatrist. So I think it's important to seek help.
Definitely. Okay, so the next question, any tips on how to handle disappointments of not being pregnant? Because I know I have a few friends who are actually trying to conceive, but sometimes it's very disappointing when you're, you know, doing that test kit and then they have that you know, pregnancy test, and then they check it in the morning just to hope that it's positive, but suddenly realizing that it's still a negative sign. So how do we cope with these feelings? Because it's actually very emotional, especially when you're looking forward to it, you know?
First, we need to be aware that that feeling of disappointment is okay. It's a normal feeling. Like, you need to acknowledge your feelings of disappointment. But what you do next after that disappointment is very important, right? So you need to be able to take the next step forward. also important is not to blame yourself or any other people, right? It's natural, you know, when you go through these negative results from your fertility treatment, you go through actually a cycle, and some people actually go it through faster, right? You will have anger, blame, and then later on you will have acceptance, right? Once you have actually accepted, then you are ready to move on. So some people will take maybe weeks, days, and some people take longer, like perhaps years, you know. They are sometimes with the negative result, they just take years to bounce back and, you know, move forward. So I hope that, you know, if the disappointment is too much for you to bear, then, you know, one important thing is to perhaps take a break. You know, you need to acknowledge the feelings, you need to be able to grieve, right? And then when you're ready, you will take the next step. And you know, it's my job also as part of the fertility team to give you that support, give you the advice that yes, we are ready, let's move on to the next step. Because majority of the couples with the right fertility treatment, they will be successful in conceiving.
Sometimes you think you can handle it on your own, but then
you need help.
Sometimes you do need help. There's no harm on getting help, right?
Yeah, for sure. For loved ones who are undergoing the fertility journey, so as a sign of support, you should be looking out for them, giving them the support that they need, and you know, perhaps advising them. I think you are probably undergoing a lot of mental stress. You know, mental health issues are. Probably we need to tackle that and address that, so that you know they'll be able to cope better.
Yes, I think the acknowledgement is important.
It's very important.
Alright, thank you so much, Dr. Natasha, for all your insights on our mental health while trying to conceive. It's actually a very sensitive topic to actually talk about, but those are actually very good tips on how we can acknowledge and accept those feelings, and then moving forward, how do we control the mental health stress in order to, you know, move forward in the journey, right?
Yes.
So also, I would like to thank 𝗘𝗣𝗜𝗦𝗢𝗑 for sponsoring this episode of Ask Me Doctor. At 𝗘𝗣𝗜𝗦𝗢𝗑, we put women at the heart of everything we do to empower and transform the way women manage their reproductive health. So we hope you enjoyed and learned from today's program. Stay tuned for our next episode of Ask Me Doctor for more health tips for the family. Thank you for watching, and we'll see you again next time. I'm 𝗈𝙤𝙣𝗧𝗧.
And I'm Dr. Natasha Noor.
And this is Motherhood.com.my. Bye!
Bye!
Find your fertile days with Clear Blue ovulation tests.